My name is Imani Rue, and this is my case study research presentation over attention deficit hyperactivity disorder. And again, the title and the topic of my research presentation is attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is often abbreviated with the words ADHD, and it is one of the most common mental disorders that affects children today. It's usually described or just talked about as fidgeting, squirming, outburst, or rowdy, like unruly behavior. And these disruptive behaviors usually lead to gaining and sustaining like healthy and meaningful relationships with peers. ADHD is a common neurodevelopmental disorder and is usually diagnosed in children, but it can last until your adult years as well. Children usually have difficulty paying attention and controlling their like unruly impulsive behavior and being like overly hyper and energetic. They don't just usually or typically grow out of those symptoms as they age. The cause and risk factors of the disorder are unknown, but researchers do know that genetics play a part in the disorder. Children with ADHD usually have a difficult time focusing and behaving on tasks, which is normal for the disorder. And like I said previously, they don't just simply grow out of those behaviors. Researchers are doing studies to come up with more ways, like effective ways, to manage the chances of an individual being diagnosed with ADHD. But like I said, because they don't know the exact cause, they are doing more research and they just know that genetics plays a part in the disorder. And typically in society, people view individuals with ADHD as defective or imperative, as if they're disabled or if they're not capable of doing things. Even though research shows that individuals with ADHD can be as competent, skilled, and personable as the average person. Most people don't view ADHD as a medical condition. They just view it as a behavioral issue, as if individuals are unable, no, that they are able to control their behavior. They're just choosing not to. They don't see it as a medical disorder. The stigmas placed on ADHD can cause self-esteem and social problems in school, the workplace, and in society. The stigmas and stereotypes associated with the disorder can affect anyone diagnosed, no matter your age, race, gender. But mainly women and young girls are affected by the stigmas and stereotypes, even though ADHD is associated with males more often than it is females. Society places a more harsh stigma on the female because if a female exhibits the traits of ADHD, society thinks that something is really wrong with her because she's unruly and she's rowdy. It's important for individuals with ADHD to be aware of their stereotypes that are linked to their disorder. This allows them to understand like the false accusations, and it helps them keep their self-esteem high and allows them to take positive action to avoid negative effects. ADHD is diagnosed by a medical doctor, and currently right now there are no tests to diagnose it. It is caused by differences in the brain's ability to pay attention, slow down, and be patient. Professionals are unsure of why these differences happen, but they know that ADHD, like I said, is genetic. The doctor is always taught to ask specific questions regarding the behavior at home and at school and in society when they are asking questions to diagnose ADHD. And they will check to ensure that there are no other health issues causing the symptoms that an individual may be displaying. And along with genetics, environmental factors such as cigarette smoking and alcohol use during pregnancy is correlated to the disease and diagnosis in children. Also, after sustaining traumatic brain injuries, children may display the symptoms of ADHD. And typically, like I stated previously, the disorder is usually it usually occurs in males, and symptoms do gender differ between gender. In most cases, ADHD can't be prevented or like avoided because researchers don't know the exact cause. But the risk for developing the disorder can be lessened or avoided. I should not avoided, but just lessened. Expecting mothers should avoid environmental toxins such as previously, like I stated, cigarette smoke, tobacco use, any kind of drug use. They should maintain a healthy lifestyle. They should limit screen time for their children. They should encourage a healthy, balanced diet. And it's never a bad thing to introduce behavioral therapy to children to help them learn what appropriate and inappropriate behavior is. There are 3 different types of ADHD. One being predominantly inattentive presentation, and that type is described as being it's difficult for an individual to organize or finish a task, pay attention to detail, and follow instructions. The individual becomes very distracted and forgets important details. The second being predominantly hyperactive impulsive presentation, and this is when the individual fidgets and talks excessively. They have issues sitting still for long periods of time, and they feel restless and exhibit impulsive behaviors. The third is combined presentations, and that is when an individual has symptoms of both the first two, predominantly inattentive and predominantly hyperactive impulsive presentation. Both of those types are equally present in the third type of ADHD. In women, ADHD may get worse with menopause because of the reduction in estrogen that impacts brain function. But every individual diagnosed with the disorder is different, and they don't respond and react to situations exactly the same. Signs and symptoms include excessive daydreaming, inattentiveness, forgetfulness, hyperactivity, squirming, impulsivity, fidgeting, disorganization, extremely talkative, disorganization, carelessness, poor time management skills, risky behavior, trouble multitasking, trouble sharing, trouble coping, and difficulty getting along with others. ADHD is diagnosed in children by a clinical interviewer. The health professionals are usually psychiatrists, psychologists, or neurologists. And a child must exhibit at least 6 ADHD symptoms of inattention or hyperactivity, impulsivity for at least 6 months to be diagnosed with the disorder. Neuropsychological testing, those kind of tests are tasks used to measure a psychological function known to be linked to a specific brain structure or pathway. Those kind of tests can suggest the diagnosis, but without a clinical assessment, that's not enough to make an official diagnosis. Young adults with ADHD are less likely than the average person to enroll in a 4-year college. They're 11 times more likely not to enroll in any school at all. 50% attend junior college, 15% hold a 4-year degree, and less than 1% possesses a graduate degree. Adults are 11 times more likely to be unemployed, 4 times more likely to be unskilled and untrained, and 6 times more likely to be fired from a job. Most children, like I said, never grow out of their symptoms as they age, but the severity of the symptoms will usually decline and decrease as they learn how to cope with age. 50% of individuals will continue showing evidence of the disorder into adulthood. And despite the 1/3 of children, despite those, statistics, 1/3 of children appear to adjust very well and become symptom-free as adults. Treatments are aimed at reducing and helping individuals manage the symptoms. And treatment helps to improve the completion of activities of daily living. And the types include medication, psychotherapy, education, and training. Treatments help decrease the symptoms so that individuals can excel in school and have successful lives. Most common medication that is prescribed for treating ADHD is neurological stimulants, and that is Ritalin or Adderall. These specific medications have a calming effects on individuals that are diagnosed with ADHD. And other non-stimulant medications work in treating ADHD as well by reducing hyperactivity while improving their ability to focus, maintain attention, and receive an education. Various types of psychotherapy are used to label ADHD signs and symptoms, and those therapies are aimed to help children and adolescents modify their behavior so that they can organize tasks, complete coursework, and process different life events, such as adjusting to moving, processing a divorce, or losing a loved one. Specific adaptations and modifications that can be used for students with disabilities or individuals with disabilities are seating students near the teacher and away from doors and windows to minimize distractions from things they may see passing by in the hallways or things going on outside. And sitting close to the teacher helps them to stay focused on what's being taught in the classroom. You can grant a student extra time for test taking because they may have a difficult time processing things as fast as the other individuals without disabilities. So they may need that extra time to complete their tests. They may need to be giving a lighter assignment load as far as in-class assignments and homework, just so that they can focus more clearly on fewer things rather than trying to comprehend several things. And you can send daily and weekly progress reports home to the parents of individuals with disabilities to show their progress and, if need be, things they need to work on. Supports is a big deal when dealing with an individual with disability, ADHD included, because a strong social support system is really crucial. Friends and family members, peers, and health professionals can be a part of that social support system. Teenagers and young adults most often benefit from working with an ADHD coach, an organizer, or a career coach. Support groups address the needs of individuals with disabilities, whether that be them dealing with loneliness, anxiety, learning disabilities, anything of that nature. These support groups show children and young adults that they're not alone, and it offers support and advocacy for their specific needs because they live with their own specific set of needs that individuals without disabilities don't quite understand. ADHD is a condition that infects millions of children and often continues into adulthood. It is a combination of ongoing issues, and the symptoms sometimes, though, can decrease with age, but some people never completely outgrow their symptoms. And treatments typically involve medication and behavioral interventions. Thank you.